On behalf of the IFA, I would like to thank Ms. Turner for presenting today and Mr. Rees for his participation. The IFA invites all participants to ask questions via the question tab on GoToWebinars. If your question isn't answered in the webinar time, we will try to answer your question in our follow-up email afterwards. With that, I'll turn it over to Natalie. Thanks everyone for joining us.
Okay, thank you, Jessica, and welcome everybody for getting up early and for some of you maybe staying late. I also want to thank International Federation on Aging and WHO for inviting me to do this presentation today. I certainly hope it will be helpful to all of you. So when we put out the marketing for this presentation, we said I was going to answer 3 questions. Oh, let me get this going, which I hope I've covered on these contents. So in the introduction and the second section of the contents, I'm going to answer basically the question, what are the main differences between age-friendly and dementia-friendly communities? And tell you a little bit about how I think the age-friendly and dementia-friendly frameworks align. And then towards the end of this presentation, I'll talk a little bit about much more about how age-friendly communities can start to take account of people living with dementia, give you some further reading resources, and maybe point out a few of the next main steps. So with no further ado, so this is a quote from a report that Jessica mentioned that I wrote when I was working for AARP in 2016. I co-wrote it with Lydia Morgan. When I first started looking at this topic, I was working at AARP both on age-friendly communities, but I was also part of the advisory group as Dementia Friendly America started to get off the ground. And I heard this quote here is just one, but I actually heard people from both sides, from both age-friendly and dementia-friendly, suggest that somehow the other was either already covered by what they were doing, was maybe a bit unnecessary, or maybe even missing some of the point. However, on the ground in the States, people were being presented with these 2 initiatives with obvious overlap, many similar objectives and stakeholders, but actually with little idea about how to work these 2 together. And that was a question I found myself wanting to answer, and that's how that paper came about, and the above is an extract from this slide. And what we found, and I think this has continued to be a bit supported from conversations I've had with others, is that age-friendly may actually inadvertently neglect the specific needs of older people with dementia, but that it does, however, have a much broader reach, and therefore could also have the potential to sustain and increase the reach of dementia-friendly actions. I'm sure many of you have your own views based on experience in your own work, but mine is that actually it's beholden on us working in this sector to try and get it right and try and reach all older people as much as possible. So that paper actually has recommendations for both age-friendly and dementia-friendly communities and how they can learn from each other. But for this presentation, I'm going to focus a little bit more on age-friendly, and if you want other information, the report, which I include a link to at the end of this presentation, you can go and take a look at that. I'm also going to assume probably a more than basic knowledge of age-friendly communities and the WHO framework for this presentation, and go into a little bit more detail on dementia-friendly. And the caveat as well from wherever you are in the world is that somewhat my experience is a bit based on the USA, which that report was done on, and also my experience in the UK. However, I'm also finding that dementia-friendly is such a variable concept that making sweeping statements anyway is a bit foolish, and the literature is growing, so let's hope this gives you a good place to start. So why is it important? Well, I probably don't need to go over this for many of you. But dementia is growing an urgent concern for our populations as they age, and we've got some stark figures there at the top. But there's another reason why it's quite important. 52% of people aged 60 and over named Alzheimer's in a YouGov report in 2015 as their greatest fear, and that includes above any other disease. And so it's a level of fear and stigma that actually increases as people age, as particularly relevant to older people. The estimated cost is 1 trillion around about now. 2017-18 is also estimated to governments as being $1 trillion a year, which is enormous. But the human cost can't be forgotten here, especially caregivers of people living with dementia, many, in fact most of whom are already, I think the typical caregiver for a person with Alzheimer's is a middle-aged or older woman, usually a daughter or a wife. So how have we got to where we are? And when I talk about where we are, is me giving this presentation and saying that I don't think dementia-friendly and age-friendly is hugely aligned. I think there are a few examples of where people have really got it right of bringing those two things together. And there's probably a few reasons for that. Some of it is about history. There are actually few countries where the two have coexisted equally or started together. The opposite examples, in fact, are the US, where age-friendly had much greater traction, being led by ARP, has couple of hundred communities signed up, and actually dementia-friendly America was a relatively new initiative. And the opposite is the case in the UK, whereas age-friendly is still only around about 20 communities, and there are over 100 dementia-friendly communities in the UK. Another reason is that in the WHH framework does not address dementia, or hasn't. The original guide and foundational documents doesn't mention dementia. There is an issue around engaging and reaching older people generally in age-friendly communities. It takes time, planning and resource, and that is even harder when it comes to include people with dementia. That's also then compounded by older people rarely wanting to be lumped together, especially where the fear and stigma exists around an issue like dementia. There are also differences in leadership and stakeholders, so these things are not always connected at that level. Much of dementia-friendly work can be led by dementia-focused NGOs, sometimes health and care services, whereas age-friendly is traditionally more local government-led. So age-friendly communities. I'm just going to go into a little bit of detail about the history and definitions, because I sort of mentioned that history may have given us a bit of a path as to why we are where we are. So with age-friendly communities, their WHO framework is the most understood and far-reaching, and it was actually set up and scaled out relatively centrally. There are underpinning documents, starting with the guide and checklist in 2007. It was scaled through a global network, and although it has been adapted, and there are locally, it is and has remained relatively uniform and recognizable as a framework. So there's no single definition, but the WHO's is the most commonly cited one. I probably don't need to read that out to you. You can read it perfectly well on the screen. But WHO's definitions have tended to concentrate not only on adapting cities and communities for inclusion, but also thinking about promoting the kind of behaviours that help create a healthy and active later life. Contrast that with dementia-friendly communities, which has taken hold globally much more recently, though there were efforts started in some countries over a decade ago. It was actually the G7 in 2013, the Dementia Summit here in the UK, that helped promote that work. And now initiatives have gone much further afield. There's one I mentioned already that was established in England. There is, in fact, no single dominant framework or definition for dementia-friendly, but there are significant national models and broader kind of typologies beginning to emerge. So people are starting to look at how we can say, what do dementia-friendly communities have in common? Though it's probably also worth mentioning at this stage is actually, though the evidence base is increasing, we don't actually know yet what a good dementia-friendly community ought to comprise. I also think it's worth mentioning that even though there are variations in definitions, common to all those definitions tends to be an emphasis on the social rather than the medical view of the illness, and increasing awareness and challenging stigma. That's very much front and centre. So how do the frameworks align? I'm going to take you through a little bit of a gallery here, quite quickly I hope, so that you can see some of the common features, and then I'll pull out in the next couple of slides after that what I see as things in common, but pull out the main differences for you. So most of you will recognise this. That box on the left is my own creation there, so apologies if that slightly gets it wrong, but that's the WHO World Health Organization 8 domains or topics. I think of that as the content, the what gets done in the different areas about what makes a good later life for people living in a place. It sits within a program framework that has clear steps and a timetable of around 5 years, and it includes political commitment, multi-sector partnerships, ownership by older people, and equity runs through the heart of it. If we compare that to, if I start to look at, so that's the one I talked about, which is relatively uniform and well understood. So even where communities, and I'm thinking of Wales as an example, which hasn't taken on the whole of the program approach, it uses the 8 domains as a way to structure its thinking about later life. So this is the first of the frameworks I want to show you that's around dementia-friendly communities. This is Dementia-Friendly America, which is more of a national model, and this focuses on the sectors. It's built to align partially, at least, with age-friendly domains, but it focuses on specific actions that sectors can undertake, such as faith groups, financial and legal services. There's a broader set of steps and advice on who to engage, but it's also based on the Act on Alzheimer's in Minnesota, which is a specific state model rather than something that was developed to move nationally. So I just wanted to highlight to you where you might be able to see. So if you can see the transportation and housing and public spaces, place spaces, you can see that's familiar. Maximising independent living and meaningful community engagement, that's also strongly within the WHO framework. But then it pulls out things that are specific to particular sectors, which is not something that the WHO does. Another more recent typology is Alzheimer's Disease International, which has put together 5 principles around what dementia-friendly communities hold. And they are people, community, organisations and partnerships. So if you can look here, people like age-friendly, people living with dementia are absolutely at the heart. And you'll see already, we're looking at communities, we're thinking about the physical and the social environment. The partnerships are about multi-sector, and then the organisations, a little bit like the sectors that we looked at with Dementia-Friendly America. It is about public-facing services on the whole and changing attitudes. Another one that you might also have seen, this was first suggested by Innovations in Dementia in 2012, and then recently a report by Imogen Blood and Associates in conjunction with Innovations in Dementia put this out in a nice, clear manner. Again, people living with dementia are absolutely at the centre, and then you can start to see again some of that physical adaptations to the physical environment, and then the networks on the bottom right and the people. You're thinking about awareness raising and the networks, the multi-sector. So that was a little bit of a race through. I've attached at the end of this presentation, in the resources, you can go and take a deeper look at those frameworks. That's actually a really shorthand way of saying you can't simply align a single dementia-friendly communities framework against, but there are some common threads emerging throughout. They are also largely because of the way dementia-friendly has been, the history of it and how it is developed differently in different national models. They're largely retrofitting in a way. So what has gone before, how do we describe it? Rather than like the WHO model, although that was very much focused on research from older people in 33 cities, that's something that was developed and then spread outwards. So I think you can look at it as we've arrived in a very different place. Having said all of that, what do they have in common? So both have a focus on helping people remain independently included in their own community. They've also recognised the role that local services and amenities play in improving quality of life for residents. So they are very place-based. Both put people with lived experience at the centre. Both emphasise both the social and the physical environment, though dementia-friendly communities often place a greater emphasis on the attitudes of staff than the physical features of amenities. And both engage a broad set of multi-sector stakeholders, although there are different specifics about who might be involved. So in dementia-friendly, you might find key areas such as legal and financial services being much more prominent, based around the vulnerability of older people with dementia, living with dementia, to fraud or financial abuse. How do they differ? And I think this is probably could go on a little bit longer about this, but I think the first one that you probably notice is it's disease specific. So dementia friendly is by definition focused on a disability or disease. Now this is probably the most controversial point, because for many focusing on a disease first and the person second is problematic in itself. Associating aging by a disability, and one which is often typified by loss or decline, can also be said to kind of counter the positive narrative aging that actually we're trying to develop through age-friendly communities, and that is already too often missing in the mainstream media. So this is another reason why I think it's quite difficult. It could also be argued that it splits efforts into unnecessary subgroups within an aging population. So, for example, what's next? Diabetes-friendly communities, for example. However, that all said, many also point out that dementia itself is a unique and urgent issue that's not yet received enough attention or recognition. And while ultimately the ambition is for all people living with dementia to be more visible and included as a matter of course, that's not where we're at. And I think we haven't got that there yet with age-friendly. It is also possible to live well with the disease in the community. And this lack of positive imagery that is possible to achieve with dementia-friendly communities is not yet visible. So moving on to that, from the disease-specific lens, and I'm sure we could have a very long conversation about that. Maybe we will have questions on it at the end of the session. The second one is around combating stigma and raising awareness, and I think that is linked to the first. So this is absolutely front and centre in dementia-friendly communities in all definitions and all frameworks that have been put forward. So while age-friendly domains do address respect and social inclusion, it is less prominent, and we're not required to address stigma associated with dementia and put forward positive images around that. Timetable and political commitment. So age-friendly builds in a 5-year programme cycle, and that's enough time to gain the written commitment of the lead elected official or mandated official. By contrast, dementia-friendly communities can actually be more flexible and quicker to apply. So even where there's a set of 4 steps in the dementia-friendly American model, its 4 steps can be achieved in 18 months or less. However, there are advantages and disadvantages to both. So while dementia-friendly can potentially be more nimble, having a timetable and political commitment for age-friendly can help embed that work within a much broader conversation with political conversation around changing demographic change. And that also can help embed it within broader planning structures and systems, as well as unleashing resources that aren't always as available to smaller and grassroots efforts. So ultimately, I think age-friendly could be set within a much broader context, even though it can take a lot longer to get off the ground. Specific actions and stakeholders. I'll go back there. Talk about this a little bit more in the next section. So age-friendly provides quite a broad framework within which communities can identify their own priorities. However, it does mean that the specific actions to address the needs of people living with dementia are often not met. And final, fourth, can't even count, fifth, focuses on prevention. So age-friendly is built on public health principles and has a large focus on promoting healthy behaviours. So, for example, wide-scale promotion of walkable neighbourhoods. And this is much less prominent in dementia-friendly. It doesn't really show up in frameworks and definitions. It's not clear why, but partly perhaps because the evidence base is less well established around that healthy ageing in dementia, although that's increasing when you think about reducing risk of dementia and slowing the rate of decline. And finally, the engagement of caregivers. This is absolutely much more central, front and centre in dementia-friendly communities. There are a couple of reasons for this. One, because you think about the impact on caregivers themselves, who are working with people living with dementia, but also the fact that some people with dementia, although they may manage many of their areas with little support, areas of their lives with little support, especially early on, many more rely on the support of friends and family. And dementia-friendly communities have to think long-term about helping people prepare for a time they may be less able to make decisions on their own. That's a really, really quick run through. The report that I wrote in 2016 goes into a lot more detail on both of those. But what I wanted to do was kind of come forward with some, okay, so what? So they're similar and they're also a little bit different. If I'm in an age-friendly community and I want to look at those 8 domains, what are the kinds of actions or the kinds of things that I could be pulling out from dementia-friendly communities that might actually meet the needs of people living in my community, living with dementia? So here I just wanted to identify some areas you could focus on. Challenging stigma and raising awareness. I think I've mentioned that. So while both age-friendly and dementia-friendly emphasize community attitudes and positive, this is absolutely a core feature for dementia-friendly. And one of the key ways that you as age-friendly communities can improve the lives of people living with dementia is by making visible people who are living well with the disease, and bringing those positive images much further forward. So examples of work that are going on globally in this or in different places are the Dementia Friends programs. You're probably aware of these. But these are national programs on the whole which train people across the country in basic awareness of dementia, including that it is possible to live well with the disease. And people who are trained then turn that understanding into, say, practical actions such as helping someone or further spreading the word. There are several Dementia Friends initiatives across the world, Canada, Japan, England, Scotland and Wales. It's also a simple way that an organisation or community can just take action to improve the lives of people living with dementia in their community. Another one is, I talked a little bit about attitudes of staff being more important than the physical attributes of amenities. Training for transport drivers often focuses on recognising and understanding the needs of people living with dementia who may use their services. First Group in the UK have developed a training module which is now part of the professional competence for all of their drivers, and that builds on work they had already done with the introduction of safe journey cards to allow customers to let drivers know if they need extra help or assistance. So that's where a transport group had actually taken steps to better understand the needs of people with dementia. The other third one is that you can do to absolutely start and then move on is to include people living with dementia and their caregivers in the work that you're doing. So age-friendly can learn a lot from dementia-friendly communities about how to do this. And there's a few reasons. There's obviously the nothing about us without us. Not including people with dementia just reinforces the stigma and the image of people who are vulnerable and are being done to, not being done with. So I think it's absolutely helping people be visible and involved in plans from the start. You also have to recognise that they've got the expertise. They and their caregivers have the expertise of what it's like to live in the community and what they need. And there are a couple of ways that people are already doing this. So while actually including people with dementia at public events is desirable, it's not always possible, and it may not always be the most effective. It's a big, noisy consultations around dementia-friendly, age-friendly communities. You might not be the best place to bring in people and put them up front and have them speak or have them consult. So there are other ways of doing that. Dementia-friendly advisory groups, they have been set up in different places, including Canada and Australia. And the UK's DEEP project, which stands for Dementia Engagement and Empowerment Project, has written guidance on how to do that. And that's actually kind of a parallel system where it's a group of people living with a disease who are supported to review and to consult on plans and to influence policy and services. And you can work with local dementia-focused NGOs to get that right. The other thing is worth having a look at is Dementia-Friendly America guidance. It explicitly considers caregivers in each of its sectors. I've given a link at the end of this presentation, so go and check those out if you also want to have a sense of how you might think about that a little bit more in your domains. The physical environment is another area. So good design can help generally mitigate some of the issues that people living with dementia experiences, like confusion, memory impairment, both of which can deteriorate over time. And these are often adaptations over and beyond those addressed within age-friendly plans. So there are some examples. Signs, while all age-friendly communities include clarity of signage as potential adaptation, some people with dementia may not even recognize common symbols such as WC on toilets, so thinking about pictures as well. Clearly contrasting surfaces, so aging-related eyesight problems affect a lot of people, but actually when you're ensuring clear changes between things like surfaces such as walls and floors, if people are already feeling vulnerable, have less ability to navigate new environments in particular, and make adjustments for what their eyes are seeing, these can really make a big difference. Familiarity and ease of use is another one. So, I mean, we've all been, I think, stood in public, well, I certainly have stood in public bathrooms, waving my hands at mysterious taps that don't seem to come on when I want them to come on. You think about that, how that can be even worse for someone who's already struggling to understand and how to use something. So having familiar fixtures and fittings can make a huge difference. Same with home adaptations, important for everyone. Specific ones are available that can help mitigate for cognitive impairments. A really good example someone told me about once was that's very low tech, not high tech, was someone they knew with dementia was at risk of eviction because they kept flooding the flat, the apartment below theirs, because they kept forgetting they'd run a bath. And so you could just chip a little, fit a little flotation device on the plug so that when it got too full, it just pulled the plug out. And those are really simple little things that can actually help someone stay in their home for a lot longer with dementia that we might not be thinking about when we think about inclusive designs. Same with outside spaces. Getting outside is important for everyone. Gardens designed for people with dementia might have more interactive features, plants with strong fragrances, they might be better enclosed, easier to navigate, and also not have toxic plants. Here's a case study I'm kind of pretty much almost finishing with. So this is from the city of Leeds. It's the dementia-friendly theatre from West Yorkshire. And I think this summarises to me not only some of the specific adaptations, but also why age-friendly, Leeds is both an age-friendly and a dementia, age-friendly city and a dementia-friendly community. Why creating space for some dementia-friendly community initiatives within your work can also have a big impact on the rest of the work that you're doing. So this grew out of a decade-long programme with older people. West Yorkshire Playhouse is a theatre in Leeds. That group was reluctant, it's called Heyday, the 50+ group. That group was reluctant to open up to discussions about dementia, although several were living with the disease. And this was when it was first proposed, they put forward, they included people with dementia in the group. So instead they took a separate dementia-friendly, dementia-focused approach, starting with trips to shows with extra support, and then came the idea of adapting performances. So the first of which was White Christmas in 2014, and it was so successful it's now part of their regular programming, and they're planning a dementia-friendly theatre festival in 2018. There are lots of adaptations that are specific to people with dementia. They also work very, very closely with people living with dementia to sit into their dress rehearsals to keep notes, telling them when they can help with transitions from scenes so they're easier to follow. Talk about when the lighting or the sound may be distracting or confusing or to people. Choosing the shows carefully. Musicals are apparently a really good choice, and also thinking about language. So the program, and the reason why I think this is really interesting is that the success of that program has been so much in terms of not just reaching people with dementia, but also showing really positive activities or positive experience of living well with the disease, that it's now started to attract volunteers from the 50+ group and has opened up conversations about the illnesses and how it affects people and those they know, and it's reducing that stigma and fear. So I've included a link to this. I've included a link to the guidance that they've set up to being able to adapt theatre performances at the end of this presentation. Okay, so I think I've convinced you, or hopefully I've convinced you. What can you do? So I think if you're an age-friendly community, ensure that people living with the disease, with dementia and their caregivers are included in all steps of the process. Start to include dementia-focused stakeholders on steering groups and work groups. Align your staffing resources from the start. US Boston Mayor Marty Walsh funded 2 posts at the same office, and the recommendations of both those posts are coming together to be pulled into one overarching Boston plan. So thinking about how you align those staffing resources from the start, or take steps to coordinate if they're also both well established. Using the 8 domains can also act as a really useful guide to adapt action plans to meet the needs of people. So use guidance that I've given you just some hints. Some of the resources at the end of this presentation can also give you tips about what you can do, and also talk with people with dementia and their caregivers. Go back and review your action plan if you've already done it. Think about when you review it, when you start again, how you can include some actions. You could consider developing a dementia-friendly community as an additional age-friendly domain. That has the potential to create some space for that initiative within age-friendly, with the idea then it affects the other work, a little bit like the West Yorkshire Playhouse. And then the other one is, if you haven't got many resources, you don't quite know where you can at least get started, initiating a dementia awareness raising program such as Dementia Friends is a really, really good first step. You can do it with an organisation, within a high street, with just a small group, or you could do it citywide. But that goes a long way to achieving some of the aims of a dementia-friendly community. So that brings me to so there are some resources here that you can take links to, and many more that I know Alzheimer's Disease International and others have produced.
Thanks very much, Natalie, for the amazing presentation. Mr. Rees is having a bit of technical difficulty at the moment, so I'm going to read questions that were sent to me from him. So I will start that off, and then my colleague Kate McCrae will ask a couple of questions. And at this point, I'd also like to invite other people who are part of the webinar to ask questions as well, and I will read those out following Kate's questions. So the first question put forward by Mr. Rees is, do you think dementia-friendly communities has something to teach age-friendly cities by using an unstructured social movement which can develop organically in very different cultures and both high and low income?
Okay. Yes, I think it probably does. I think that goes back a little bit to what I was trying to get at. I may not have got it with the West Yorkshire Playhouse example, and then also thinking about developing a dementia-friendly community as a single domain. Being quite small, being nimble, and being able to get going from quite quickly means that I think dementia-friendly has the potential to be quite entrepreneurial and innovative and grassroots, and you can create that space within an age-friendly community, I think, for that to happen. So I would say, yes, it has a lot to learn, and I think there's ways to do that which don't necessarily have it separate or entirely unconnected to age-friendly.
Thank you. And the second question I have is from Mr. Rees as well, is how are human rights frameworks used to support the actions taken in age-friendly cities?
Oh gosh, that's probably not the right question for me. Okay. So yeah, that's probably not the right question for me. That's one to take with Alana as well. I do know that human rights is an emerging priority in dementia-friendly and is being used certainly in some parts of the UK as well to think about ensuring people focus their resources on age-friendly as a protective characteristic over here. But I don't want to be talking about that for the whole movement. That's okay.
Thanks very much, Natalie. I will hand it over to my colleague, Kate McCrae.
Okay, thank you, Jessica. I suppose the first question, and hopefully people can hear me, that I had is that when you mentioned the differences between dementia-friendly communities and age-friendly communities, you noted that combating stigma and raising awareness is much more of a priority in the dementia-friendly communities. And I was wondering what your opinion on maybe why age-friendly communities don't tend to prioritize that as much.
Yeah, it's a very good question. I'm not entirely sure why they don't. I think it's probably because it's one of several key issues. I know that certainly within the domains, when you start looking through the checklist, it's sort of buried in there. It's not as prominent as a goal. However, that said, I do know that changing the narrative around aging remains a focus for national national programs on age-friendly and local cities. I think it's much more to do with that urgency of dementia is stigmatized, not well understood and feared much more than aging itself. So I think it's feeling like dementia-friendly starts from a much lower bar in terms of how people feel about it themselves.
Okay, thank you.
But it's a challenge. I think it's worth saying it is a priority for age-friendly, but it's just not as front and center.
Okay, thank you. And then I guess the other question that I came away with was, you mentioned specifically the disease-specific lens of dementia-friendly communities that oftentimes, unfortunately, does prioritize the disease over the person. So what do you think would be the best steps to adjust the lens so that it can focus both on the disease and the person with that disease?
I think I think there's lots of debate. It's interesting. It's a shame that Glenn can't get on to answer this. I think even from what I've been reading and from hearing, that even within dementia-friendly communities, the discussion about, there's a lot of debate about how to do this. Is it possible to focus on both? Normalizing dementia as an illness and making it part of the mainstream culture, or understood and accepted, and yet calling it out all the time is a difficult tension. It has a tension even at a project level. So, even having a dementia-friendly theatre performance, people with dementia in the audience don't want to be constantly reminded that they're there because they have dementia, or don't want it stamped over everything. So even within the project level, thinking about how you get attention, how you make adaptations, how you get resources for something without calling it out, that's a tension that happens right across NGOs. And I think you have to figure it out with the people at that local level, what works for you. Ideally, we get there so that we don't have to separate it out in the next 10 years. But yeah, we're not there yet.
Okay, I'm going to ask some questions from participants at this point. So the first one is, do you recommend a particular approach for communities just learning about both movements, age-friendly and dementia-friendly, to help avoid them being overwhelmed by multiple frameworks and resources?
Yeah, I think starting with the Dementia Friends or a dementia-friendly awareness approach is a good place. If you want to do an action, if you're a community, I think it would be reaching out, if you're not already linked in, reaching out to a dementia-focused NGO and starting to talk to them about one specific action that they could do together. So I think it's really not trying to do it all at once, but make those connections, start to have a conversation with people with dementia about the issues in their community, and or thinking about a dementia-friendly, Dementia Friends awareness program, which is a really simple place to start. And you'll draw people in, you'll find the champions that way, actually, and then there will be obvious what to do next.
Okay, thank you. So the next question is, how does dementia-friendly communities encompass both urban and rural people, considering the geographical distance between groups? In addition, this includes disparities between socioeconomic groups.
Oh my goodness. Yeah. So I think probably the first way to answer that is not to put myself out as an expert on dementia-friendly communities, so which are as different as the day is long. But I think one of the ways that dementia-friendly, from what I've understood, can get over some of these differences between urban and rural and wide difference in socioeconomic is that they start very small, and they are much more able to be adapted to as much as starting off with a group or with an organization, and the group itself doesn't have to be place-based. So it could be an identity group. So with potentially, if you're looking at a black or minority ethnic group, working with the people there living with dementia and thinking about how their community, which might not even be place-based, could be adapted. So unlike age-friendly, where you need to go in at that kind of political commitment level, although there are small places that do it, dementia-friendly can start with just one street, just on a high street or a building or a small group. So it is able to be more flexible like that.
Thank you. The next question is, what are the strategies you have employed for bringing on communities through using Dementia Friends?
Right. Yeah. No. I think I'm not in a position to answer that. Actually, it's something I've seen, but I don't think I can answer it.
Fair enough. Okay. So then, moving on to the next question: how can age-friendly cities and communities be accountable to all older people, regardless of a diagnosis, but rather based on functional ability?
So I think that goes back, that goes back to the very beginning of my presentation. So yes, we are, the disease-specific lens, are we in danger of splitting? I mean, that's one of the biggest criticisms of dementia-friendly communities. Yes, are we in danger of splitting it up into diabetes-friendly cities? And yes, I mean, we've got child-friendly, we've got age-friendly, we've got dementia-friendly. I think that we have to sometimes kind of take a step back and kind of go, well, we are where we are. These initiatives are gaining traction. I think this is where I come at from a very pragmatic perspective. In the US, it didn't matter whether we didn't believe that we ought to be splitting these movements up. Dementia-friendly America had gained traction. It had supporters, it had champions, and had a group of older people that actually we weren't reaching particularly well as a community. So I think there's something about being both pragmatic in terms of understanding that dementia-friendly is out there and that we have to look at its strengths and we have to work more closely with it. I certainly wouldn't be encouraging diabetes-friendly cities or MS-friendly cities, but I don't think we're in the same position with those as we are with dementia, which felt like it is a specific, very urgent, probably very unique situation that does affect people who are aging, although not all people with dementia are old and not all older people get dementia. We are talking about a subgroup that were largely being ignored and not being well recognized. So yeah, I think I've suggested one way of thinking about dementia friendly. You could make the same approach. I mean, I think diabetes and MS and both of those are about healthy aging more generally, but yeah, so that feels like a very incomplete answer actually. Ideally, we would be able to encompass all of the people that we're working with, and I think it's about consistently trying to reach out to different subgroups in our community. But in this instance, I think we had to become pragmatic about reaching out to our friends in dementia-friendly community, and I think there's a really strong case for them having space anyway.
Thank you. We're getting quite a few questions, so I'm going to hand it over to Kate, and she has a couple more questions.
Okay, thank you, Jessica. So the next question from me, when you were discussing the differences between age-friendly and dementia-friendly communities, which of these do you believe needs to be addressed the most, or do you actually think that any of the differences really need to be addressed in order to bring dementia-friendly and age-friendly communities together?
I think the first one, which I hope I tried to answer to the other caller, was including people with dementia and caregivers in the processes. So I think that's about actually reaching people living with dementia and caregivers in the community and finding some way of ensuring their voice is heard in what you're doing. And that in a way answers the previous question. If you're doing that, you shouldn't necessarily need to set up separate initiatives. But if you're not, and you want to start somewhere, the next one is around awareness raising and breaking down stigma. So I think those are the two that need to be addressed most urgently.
Okay,
making people living with dementia much more visible, and especially people who are living well with the disease, that there are many people who are living in the community and managing well, although that's not to neglect the fact that it is a disease which declines.
Okay, thank you. So you gave the example of, I believe, now I'm going to forget, and that's very bad of me, but I believe it was Detroit who actually hired, in developing their age-friendly communities, they hired 2 different positions, one to represent age-friendly, one to represent dementia-friendly, so that they could both give experience that would then be combined to the larger framework. Would that be your recommendation for communities who are looking to moving towards being both age-friendly and dementia-friendly, would be to hire 2 positions who can give the individual experiences that will then speak to the larger experience?
Yeah, I think so. I mean, we have to cut the cloth a bit to fit the resource. So that was Boston, actually. That was Boston in the US. And that was the mayor, that was a new mayor, newly elected mayor, for whom aging and older people were a really key issue. And he wanted to become both an age-friendly community and quite quickly reached out to AARP. But he also was developing a mayor's Alzheimer's plan as well. He wanted to do that. So I think it's, if you have, they were in a very lucky position that he therefore put the resource behind it. Not everybody is in that situation. However, if you've got, if you can have 2 separate bodies, then yes, that makes sense. You have those 2 perspectives. You may want to make it part of one person's role, or if it's quite often, even with age-friendly, you're talking about someone who has this on their in their job for 1 day a week. There are very few places that have people that are set up just to do age-friendly full-time, and that's a luxury. So it's thinking about that 1 day a week, where else in the office, making sure that people sit close to each other if possible, are co-located in some way. Sometimes it's Alzheimer's groups that are leading dementia-friendly. Is it possible for the person who's leading dementia-friendly to co-locate into the local government office 1 day a week so that things can be more aligned? Taking steps in that way, I think, so that people get to know each other.
Thank you,
however that you can figure it out within your resources, but ideally, yes, I think, that would be a great example of how you could do it.
Thank you, Natalie. One final question before we wrap up is, in rapidly aging societies, do you think the age-friendly concept will become redundant?
So could you repeat that?
It says, in rapidly aging societies, do you think the age-friendly concept will become redundant because older people are the new norm?
No, I don't think so. Yeah, I think that ideally, yes, maybe, but just because there are more older people doesn't mean we're getting it right for older people. I think society has to adapt its structures, its processes, its decision making to really actually make the most of both the opportunity and help get over the challenges. And actually older people themselves, and in some ways I think we need to give a nod to dementia-friendly communities. People living with dementia and other who are using much more the language of human rights, about a right to inclusion, a right to acceptance, are sometimes further ahead of people who are just considering themselves getting older, who do not always want to consider themselves as having rights to access and rights to services. That ageism in the society is often internalized by older people themselves. So actually I think there will always be a role for that activism for older people.
Great. Well, thank you for your wonderful answers to all of these questions. Do you have any...
Sorry, I feel like I'm a bit of a sort of jack of all trades and master of none, so please do read some of the things I've put up, because actually there's some fantastic resources out there that people, and it's a growing set of evidence and literature in this area, so I think you probably can learn from this better almost than ask me.
No, you've answered the questions very well, and the IFA will send out a wrap-up which will include the resources as well as a couple of additional resources from Mr. Glenn Rees from Alzheimer's Disease International, so that will go out most likely on Monday. So if you don't have any final words, I'd just like to say a very big thank you to you, Natalie. Your presentation was fantastic and very informative, and we really appreciate it. And a thank you to Mr. Glenn Rees as well for sending some very great questions. as well as a thank you to my colleague, Kate McRae, for her assistance in this, and to thank everyone for attending. You've all been fantastic, and on behalf of the IFA, we really appreciate it. So thank you, Natalie.
Thank you all. Thank you so much for listening.